Well, thank you, everyone. My name is John Pease, and I'm an assistant U.S. attorney from the U.S. Attorney's Office in Philadelphia. And I'm going to ask everyone to just bear with me for a second, because asking a lawyer to talk about any topic for 12 minutes, it's kind of like telling a food critic you can go to the restaurant, but you're only allowed to read the menu. So I'm going to do the best I can. But in all seriousness, it's a real pleasure and honor, actually, for me to be invited today to talk to you about healthcare fraud, a subject that is of intense interest to me, and really of great national interest as well. And really there are three sort of takeaways I want to try to get across to you in my 12 minutes before I get yanked. First, that healthcare fraud is a top priority of the Department of Justice and U.S. attorneys' offices around the country. Second, we are getting better at it every day and using better and more technology and getting more resources to identify, detect, and prevent healthcare fraud. And then lastly, the last point I want to get across with all of you is that we are very interested in working more collaboratively with our counterparts in private industry, especially in the compliance function. And I'm going to give you two real-world examples of how having an effective compliance program, along with making self-disclosure, resulted in tangible benefits to certain healthcare providers. So let me start off also with just one more caveat. The views I'm going to express are not intended to represent those of the Department of Justice. They're my own views. I've been a federal prosecutor for 14 years, prosecuted every type of fraud case there is, with a special focus the last couple of years on healthcare fraud. Healthcare fraud is like any other type of fraud that I've seen, except there's really one thing about it I think that makes it special, that makes it unique. That everyone in this room has a stake in healthcare fraud and our healthcare fraud benefits. Every one of us pays Medicare wage taxes. Every one of us knows somebody enrolled in the Medicare program. Those who would steal from Medicare steal from our own pockets and put at risk the trust fund that we hope someday will be there when we need it. And so while there's many types of fraud cases, there really isn't one type of fraud that I've seen that has a broader impact on our society, a bigger impact. And that's a point I try to get across to federal judges at sentencing hearings where we're dealing with somebody who commits fraud. They're not just stealing from a nameless victim, they're really stealing from all of us. And in recognition of this, really in Philadelphia, our U.S. Attorney's Office has really been at the forefront nationally in prosecuting this war in healthcare fraud. Our office has about 130 prosecutors, and we have a special team of about 9 assistant U.S. attorneys who I supervise, whose job it is to investigate, prosecute healthcare fraud. But we don't do it alone. If any of you ever watch Law & Order, you'll see the police go out and catch these bad guys. They turn them over to the prosecutor at the DA's office, and it's their job to prosecute and win the case. It doesn't work that way at the U.S. Attorney's offices, and it doesn't work that way in healthcare fraud. It takes a team of people to be able to bring these cases together. Now, we're here today at the U.S. Department of Health and Human Services, and Nick DiGiulio is a valued partner, and he and I work together in the Philadelphia region. But there really is a tremendous interest among other federal law enforcement agencies in prosecuting healthcare fraud. The FBI in our region has a dedicated team of 15 agents who do nothing but healthcare fraud. Food and Drug Administration has a team of 6 agents who work with us on healthcare fraud. The U.S. Postal Service, the Defense Criminal Investigative Service, the Office of Personnel Management, and a host of other federal agencies all are involved with us, working together, investigating and prosecuting healthcare fraud. We simply can't do it without those types of resources, and we work these cases from the ground up at the beginning of the case, and we don't wait until the end to decide whether or not a case has value or whether it has merit. Now, in Philadelphia, we've really been very fortunate. We've, in the last year, received additional funding from the Department of Justice to hire what's called a special focus team. So with additional funds, we've been able to hire more criminal and civil prosecutors. We've been able to hire 2 healthcare fraud auditors with more than 30 or 40 years experience in the healthcare industry. We recently brought on board an investigative analyst who has 20 plus years of healthcare fraud experience. We have a biostatistician. We have more support staff. We've got a real strong commitment in Philadelphia, and not just in that office, but really across the country. Our office, working collaboratively with the Department of Justice here in Washington, has made a real effort to do outreach to other U.S. attorneys' offices across the country to combine our knowledge and share resources. So I want you to know that in the Department of Justice, we are really working hard to make the most and benefit from the experience and the knowledge we've gained in these various healthcare fraud cases. And we're communicating not just with each other, but with our partners at Health and Human Services and other agencies. Now, there's been some talk today about the use of data. And I mentioned in my initial remarks, we're getting much better at using it. And so in these cases, we're not just sitting back and waiting to get a tip on the tip line or waiting for a whistleblower to file a False Claims Act complaint. We're trying to be a lot more proactive. And this is really where, in part, our efforts to do more outreach with private industry come into place. Our office, we don't just prosecute Medicare fraud, we prosecute all healthcare fraud. So, for example, Independence Blue Cross, which is a major health insurer in Philadelphia, has become a real partner of ours, and they've been employing real sophisticated data mining techniques and have made a number of referrals to our office, and we've taken those cases and run with them. In the last year alone, we prosecuted, off the top of my head, I can think of at least 4 chiropractors and a number of other healthcare practitioners whose billings and claims histories and then internal audits that were done by this healthcare insurer resulted in anomalies that being identified, resulted in fraudulent claims, and we've taken those cases and we've run with them. And doctors and other healthcare providers who defraud some of the companies you work for, who defraud private insurers, also are likely to be defrauding the Medicare program and vice versa. So I think all of us really have a stake in trying to root out, identify, and prosecute some of these unscrupulous individuals who engage in this healthcare fraud. Now, we've had really in the last year or two alone, there's a long list of physicians, nurses, chiropractors, durable medical equipment company operators in our region and really nationally who have been prosecuted. And I could go through statistics and long lists, and your eyes might glaze over. The real point I think I want to really get to, though, is, and I think maybe of real interest to some of you, is how does a prosecutor at the U.S. Attorney's Office look into and try to make decisions about what kinds of cases ought to be prosecuted? I think it's been mentioned in some of the remarks this morning. We don't prosecute mistakes. What we're looking for is knowing and intentional fraud, knowing intentional efforts to engage in fraudulent practices that result in the payment of funds that you wouldn't otherwise be entitled to. But that's not the only factor. We're also looking to things like the amount of the fraud loss. Is this a case in which there's going to be a deterrent effect? We can't prosecute every case that comes into our office. We look for cases where the conduct is serious. We look for cases where the fraud loss is substantial enough that it's likely to result in a potential prison term. We want to know how pervasive it was. Is it a one-time problem, or is it conduct that occurred over a longer period of time? We're interested in knowing in every case whether there have been any prior regulatory actions against this healthcare provider or individual. Has this person been counseled, for example, by a CMS contractor who went out and did an audit and found problems, sort of the example that Nick talked about a few minutes ago? All of these are sort of efforts along the way, and most of today's discussion talks about the administrative sanctions that may exist and regulatory compliance efforts. I'm here today sort of as an example of what happens to you if all those things fail, because at some point you have to go to jail. Some of these individuals are not going to be deterred by the threat of sanctions, by the threat of having payments or monetary penalties imposed. There are some individuals, and we all know that it's true, who have to be prosecuted. And the only real deterrent in these cases is going to be prison. And so we're looking in prosecuting individual cases and asking ourselves, is this the kind of case that other physicians, other healthcare providers are going to look at and potentially put on the brakes? We'll never know, and as prosecutors we always talk about this, and judges always ask questions about this. If I impose the sentence you're asking for, Mr. Pease, if I give more time to any individual, how am I to know that's going to have an effect on someone else? And the answer is we'll never know how many individuals out there did not commit fraud as a result of any one individual prosecution. But what we do know is that there's no shortage of new cases that come in. And so we have to be vigorous, and we have to, when we find it, and identify it and prosecute it vigorously. Now, other issues that we talked about a little bit before, in the case of a criminal matter, for example, one of the things that we generally don't get into in prosecuting is a debate over medical judgment. The use of the administration of any particular service. If there's a reasonable debate among physicians about whether it's medically necessary, that ordinarily doesn't lend itself to a criminal case. Much of what we see and what's been prosecuted in our office are the traditional sort of bread and butter fraudulent billing schemes. Physicians who are billing as if they saw a patient in the office when they're actually in California or in Las Vegas. And we have plenty of examples of that. I'm going to give you a couple of examples as well. But in terms of sort of everyone here in the room and who's watching the broadcast, one of the most important factors as prosecutors that we're directed to look at in our prosecution guidelines, especially for organizations, is, first of all, did the organization have a compliance program? What type of compliance program was it? And was it a paper program, or was it one that had real teeth? Was it actually a program where people understood and knew what the rules were and were expected to follow them? Was there accountability in this program? Was there an oversight function? These are very important factors that we look at in deciding whether an organization itself ought to be the target and defendant in a criminal case. It's not the only factor that we look at. There are other issues as well. No company has a perfect compliance program. If that were the case, we probably wouldn't be talking to them about what happened or what went wrong in any particular case. But it is very important in understanding and identifying criminal conduct to figure out how it happened, how they were able to escape or work through whatever compliance function existed, and if it was caught or detected, was anything done about it? Or did some compliance person or did someone in management who was alerted to the possibility of some problem follow up on or take action, or was the compliance function treated sort of as an unwanted interference, or sometimes I like to refer to it as the sales prevention department. Is this the kind of organization we're talking about, or are we talking about an organization with a robust compliance program? I'm going to give you just a couple of examples of some fraudulent cases that we prosecuted, and I want to give you two cases that we didn't prosecute in significant part because of the role that a compliance program played in that particular case. One is a case involving a Dr. Ronald Bailey. He was a behavioral specialist consultant. He was recently sentenced to prison in Philadelphia, and Dr. Bailey was an independent contractor for two nonprofit organizations in southeastern Pennsylvania that received Medicaid funds, and his job was to provide counseling services primarily to autistic children. And he was paid on a $45 an hour was his rate, and so he was required to submit time cards and summarizing the amount of hours. Well, unfortunately, Dr. Bailey submitted to each agency that he worked for time cards that overstated the amount of hours he was spending counseling children and families. And so this went on for quite some time, and one of the, in these agencies, they began to review his billings and then realized that he was working two separate places, and these two compliance folks communicated with each other and recognized that because he was working two different places, they wanted to take a further look into the possibility there might be some issue. And so the compliance function examined and sort of shared information, cross-referenced his billings, and what do you know, Dr. Bailey claimed to be at two different places at the exact same time counseling two different children. And so they did a full-blown audit, analyzed and assessed what they thought the overpayment was and the loss to the Medicaid program. They hired outside counsel who called me, and I called HHS. We did an investigation along with our partners at the State Attorney General's Medicaid Fraud Control Unit, and quickly brought the case to a resolution. Dr. Bailey pled guilty. Each of these two agencies made the Medicare program whole, repaid the money, and neither one of them was prosecuted. In theory, as a technical matter, they could have been prosecuted. They're liable for the false billings, the fraudulent conduct, but because they made proactive steps, they didn't just ignore it when they came across a problem. They made a referral and a self-disclosure. That was an important factor in that case in deciding what to do. Another case, it's an ongoing case in Philadelphia. A physician, an ophthalmologist, was charged in a 144-count indictment with healthcare fraud and making false statements in medical records. In that case, the compliance department of this health system did an internal audit, analyzed his billings, had a team of auditors working, and discovered that this physician, while claiming to be at the hospital seeing patients, was actually either on leave or at CME conferences on the other side of the country or in a different office as part of this health system. They made a referral to HHS and to the U.S. Attorney's Office. We did a thorough investigation, looked into the conduct, and made a decision that we would only charge the physician and would not charge this health system, this healthcare provider, with any criminal activity. Does that mean you don't have to pay the money back? Of course not. They're going to have to repay the money. They're working on a False Claims Act settlement with our civil division, but you're in a much better position, I think, dealing with the civil and administrative side than you want to be in the criminal side. And with the criminal side, it's not just the issue of a potential conviction you got to be concerned about. There are all these collateral consequences. Obviously, we can't put companies in jail, but we do prosecute them. And one of the reasons we prosecute corporations is to send a message of deterrence. And in certain cases where the conduct rises to a pervasiveness and a level involving a significant manager or operator of one of these organizations, just prosecuting the individuals isn't enough. And another reason we'll do it is because of the administrative sanctions. And you've heard a lot today about the exclusion authority, and companies and entities, just like individuals, convicted of healthcare fraud can be excluded, and there are times and appropriate places when that should happen. And that is a serious potential risk and consequence for any healthcare provider in terms of deciding whether you're going to have a compliance program, and then secondly, how rigorous and robust it's going to be. So you don't want to wait until you find out or learn about someone in your organization, some provider that you're dealing with engaging in fraud. You want to think, as some of the terrific panelists have talked about today, what does my compliance program look like? What's a federal prosecutor going to think about it 2 years from now after agents show up and do a search warrant and have one of our doctors or one of our nurses in the crosshairs of a criminal case? What's the Department of Justice, what's a prosecutor going to think when they begin talking to my compliance director, when they begin asking whether we have auditors who went out and did on their own audits to look into billing anomalies? Were there red flags along the way that were not going to be followed up on, that were ignored? Because in every one of these cases, those are the kinds of things the prosecutors are going to look for. They're not just going to think, all right, we've charged a nurse, we've charged a doctor, our job is done. In any of these cases, with limited resources that we have, we want to send a sign of deterrence. We want to identify all of the wrongful conduct. And not just that, we want to figure out how it happened and why it happened. And so, those are some of the most significant factors. I mentioned the third point that I wanted to talk about briefly, and that is reaching out to all of you. I'm happy to talk with any of you about what we're doing and encourage you to reach out to us at any time. I'm getting the threat of exclusion by one of our distinguished guests. So before I'm excluded, I will end my remarks and thank you very much.